Just doing a mic check. We're about to begin shortly. Doing a mic check. We're about to begin shortly. All right, for those who are still watching on YouTube, um, I'll be here for you guys. And if you have any questions, you can feel free to ask here. But otherwise, we're going to be streaming the same thing simultaneously on Microsoft Teams. So I'm just going to make sure that all my settings are correct, and then we shall begin with the class. Okay. All right. So welcome again, everyone, to our patient health workshop. And if you are, when you come in, I'm going to ask that you kind of mute your um, speaker. I don't have headphones on, so it may create a little feedback experience for me when your mics are open and then my own voice is coming back through your microphone. So we might have a little challenge there. So just make sure that you're muting for me. Okay. Okay, everyone. Welcome again. And what I'm going to ask that we all do is I'm going to post a link both in the chat as well as on YouTube for the downloadable handout that goes with this lecture. So that way you can have it at your disposal. So I'm going to download the handout for you. I'm going to put the link so you can download the handout yourselves. So let me just do that first. All right. Okay, so if you will look in the... Are you hearing me, guys? Miss Donna, are you hearing? If you're not hearing, let me know. But I've downloaded the website. Let me try it again. I have put in the chat the link for the download for the handout for the class. So I'm going to invite you to just do that. Download that now. Can everyone hear? You can just go ahead and is anyone else having any difficulty hearing?
I'm hearing you fine.
All right, can everyone just kind of check in to make sure that you're all hearing me? Donna is not hearing. So Donna, it's possible that you have your microphone or the speaker is not set up right on your device. Anyone else having an issue? Okay, Donna is hearing. Donna Vernon is hearing. Good. Anyone else? Donna Francis? All right, so as not to run out of time towards the end, let us begin. Welcome, everyone. I'd love to just have everyone in the Teams section just chiming in just to say good night. And we're going to ask that you just open your mics and just say a quick good night for everyone. And then mute yourselves again. Well, Donna, I didn't hear you. I heard a series of clicks, but I did not hear you. So maybe your microphone needs to be adjusted. Anyone else hearing me okay?
Hearing loud and clear. This is Missy.
Good night, Lessine.
Hi, Dr. Gardner.
Hi, dear. Everyone else? Anyone else? All right. So,
Good night. This is Yvette.
hi, Yvette. Good night. Good night.
Good night. Good night. Good night.
All right. So, I'm satisfied that everyone is hearing who needs to hear. So, let us begin. The topic for today's presentation is the 7 keys to getting and staying well. The 7 keys to getting and staying well. The handout should look something like this, except that it's the blanks are already filled in for you. So click on the in the chat section for the link for the handout, so that way you will have that available to you. So let us begin. This particular topic, I've selected it because it helps persons to get a good sense of what is important as it relates to understanding or the understanding of healthcare. So there are many persons who do not have a good understanding of healthcare, and so they end up being frustrated by what they get out of healthcare. So it is important that we have a good understanding. So the purpose of this lecture is to provide persons with a better appreciation of what the healthcare system is about. We're going to be talking about 2 things in particular: sick care versus healthcare, and what that is, and understand that it's not in any means a derogatory approach or explanation. So yeah, we want persons to be able to understand it so they can make wiser choices. And the unfortunate situation is that people make bad choices, but they make bad choices not necessarily because they just don't know better, but because they have a misunderstanding of what the system is about. So let me just try to explain that one first. When we talk about the healthcare system, we're talking about the system that we see that involves hospitals, clinics, doctors' offices, and so on. The thing about those things is that it's catering to the care for sick people. And because it's catering for sick people, then you find that the systems around it are centered around persons who are not well. And so they're actually caring for the sick, and the systems are what can we do to care for sick people. The focus is not so much on optimizing health, but addressing persons' illness or illnesses. And so you find that in a healthcare setting, in a medical doctor's office, or in a hospital setting, you have to have some kind of diagnosis before an intervention can be applied. So you see that the system is really one that, and it's not a bad thing, but it caters primarily to sick persons and the needs of a sick person. Now, one will think that the goal of the healthcare system is to optimize health. The goal of the healthcare system is not to optimize health. The goal of the healthcare system is to manage illnesses or help persons to manage their illness. You manage your illness by not eliminating the illness, but allowing the person to coexist with their illness. Now, in my humblest opinion, coexisting with a condition is far second to getting the body to eliminate it altogether. Far second. But important nonetheless, because guess what? Sometimes one is not able to eliminate the illness altogether. And so, in order to maintain some amount of sanity, one has to be able to coexist with their illness as long as possible. And that's where the healthcare system shines supreme. They help persons to manage or to coexist with their illness. So if you have diabetes, they're going to give you insulin or some other diabetes medication so that despite the fact that your body is not sensitive to your own insulin anymore, you're not trying to get the body to be responsive the right way. You're just providing the more insulin so that you can keep the blood sugar level within a certain range. And that might be the best that can be done for a person. However, there are some persons that want more than that. There are some people who want to actually rise above their illness and no longer have that illness without having to be propped up by some medication. And so this is where true healthcare comes in. When we're looking at caring for the sick person, which is helping them to maintain themselves or to coexist with their illness, versus true healthcare, which the aim is to eliminate the illness altogether and to get persons to resume a state of good health. And that's what I think I wanted to kind of point out first. Now, the problem with the sick care system is that sick care is reactive. Sick care is reactive. And so I'm going to just bring up at the slides here real quickly. Sick care is reactive. And because it is reactive, one has to wait until something goes wrong first, and then after something has already gone wrong, then we try to respond, hopefully in an appropriate way, to help the person to be better. So that's the first thing. But if you want to be optimally healthy, you can't simply wait until something has gone wrong. You need to preempt it. You have to go into a more preventative approach, one that sees us being proactive in our choices. So, proactivity means we're going to do things or do something to prevent the illness from occurring in the first place, or at least to minimize the likelihood that something will go wrong. And that's the goal of true healthcare. And so this is important. All right? This is very important. All right. The next thing is we need to understand that we are in a crisis as it relates to our healthcare system. We are seeing record numbers of sick people. We are seeing record numbers of people who are dying from various lifestyle diseases. An example of a lifestyle disease would be high blood pressure. An example of a lifestyle disease would be diabetes. An example of a lifestyle disease would be cancer. An example of a lifestyle disease would be high cholesterol. Why do we say these are lifestyle diseases? Because every single one of those diseases can be linked back to how we live our lives and the choices that we make for the foods that we eat, for the rest that we get or do not get, etc. These are the things that will lead to us breaking down and becoming sick and expressing ill health. But if we want to express good health, we have to make changes to our lifestyles, because the main reason people are in the hospitals today is because of poor lifestyle choices. Now, if we want to change our lifestyle, there are many people who have a hard time figuring out how to change the way they live. If you want to change someone's lifestyle, you first have to change their worldview. You have to change their worldview. You have to change the way that they view themselves in the world. If you're not able to change your worldview, then you're going to be in trouble. If you can't change your worldview, you're not going to be able to successfully navigate the waters of change. So, how do we change our worldview? Understanding that changing your worldview drives a change in your behavior. How are we going to change our worldview? We change our worldview by understanding how we're seeing things now, so that we can change the way we see things to a more appropriate way, to a more acceptable way for ourselves. This is not somebody outside of us to judge. This is for ourselves. So if you see yourself as thinking in a way or behaving in a way that you do not like, then it's incumbent upon you to change how you're behaving or to change the way you're thinking. Now, according to the illness care model, which is one of the ways that we learn how to think, and this is the way, unfortunately, that's being taught to us by the pharmaceutical conglomerates, is that if something is wrong, all we want to do is to do whatever it takes in order to feel better. We say, Doc, I have a headache. What can you give me to feel better? Or what can you give me to mask the headache or to eliminate the headache or get rid of the pain that I'm having in my head? And while that's all well and good, there's a better way to think. Rather than thinking, what do I need to do to feel better? Why not ask, what can I do to get better? In other words, how can I eliminate my need for the medications in the first place? There are many people who are suffering with chronic headaches. For years and years, they've been having these headaches. And all they do is whenever the headache comes, they take something. Eventually, the headache may go, and then they don't have to continue taking it until the next headache comes around. They don't try to see what can be done to prevent the headache from coming on in the first place. And so if that is possible, would that not be a more desired outcome? To not have to worry about the headache at all? To not have to worry about the hypertension at all or the diabetes at all? Knowing that if we make the right choices, our bodies will be able to resume its good state of health. If that were possible, then that would be preferred. How about this one? Have you ever used this expression, get well? Like this get well soon notion. Somebody has um, an illness and they're in the hospital, and you send them a nice big card or a teddy bear or a balloon or whatever it is. And on it, you will see oftentimes written, get well soon. Now, getting well is a nice thought, but it is just wishful thinking. There's nothing behind it. There's no action behind it. There's nothing that you're saying to the person that you're wishing these wishes onto that you would like for them to do in order to achieve it. It's just that they're sick, you want them to get better, so you say, get well soon. Hope to see you soon. Hope to see you out of the hospital soon. Well, the downside about this notion of getting well soon is that it's focused on the outcome. It's like you're going on a journey and your focus is on the destination. If you're driving on a journey and your focus is the destination, then the journey is only as important as it is to get you to that destination. More than likely, you're not going to be excited on your way there, especially if there is some traffic on the road or an accident on the way, or you took a wrong turn and you're lost. If the destination is your goal, then anything that takes you away or delays you from achieving that goal will be viewed as a negative. And so you'll feel those negative effects. We want you to understand that true healthcare or true wellness is not about a destination, as in getting well, but it's about a process. How do I need to, or what choices do I need to make ongoingly in order to maintain myself on this journey, this path of wellness? So we will say, rather than simply getting well, we will say stay well. So feel better becomes getting better. Getting well becomes staying well. We want to stay well. And the last one is staying alive. We use how long we live as a measuring stick for how healthy we are. And this is something, unfortunately, that we are guilty of doing over and over and over again. And that's not good. That is not good. And so we want to be able to use a different approach than simply how long someone is living as a measure for how well they're doing as far as their health is concerned. Did you know that there are many people who are actually sick but will outlive many people who are not sick? Because being healthy does not guarantee long life. It may impact the way you may die. It may impact your time for morbidity, meaning your morbidity is how your disease state or your state of health, your state of disease. Your mortality is your state of life, whether you're alive or dead. Your morbidity is whether you're healthy or sick. And what happens with somebody who is pretty healthy is that their time of morbidity shortens, so that by the time they experience a crisis, death comes soon after. Not because they're too weak to overcome the illness, but because they're not ill. And because they're so well, they don't get sick for a long time. When death finally comes, it comes with a very shortened illness period before it. Whereas somebody who is very unwell, they're going to be thrusted into a state of disease early, and that disease state will last for a long period of time. So don't think of it as simply two things: your disease state before death, and thinking, well, if you can maximize the disease state, you're delaying death. Because that's not how it is. Think of it as three stages. your health window, your disease window, and then death. With poor health, your disease window has taken up a portion of your health window. So your life is spent, instead of being in good health, a large portion of it is spent in illness. And then you matriculate from illness straight into death. Whereas somebody who is healthy, the majority of their lives will be spent in a state of good health. They may just die, or they may go through a very shortened ill health period before they die. And that is basically the biggest difference between those who are well and those who are sick, is that window of morbidity. How long are you going to be diseased for before you ultimately die, and how much of your good life has been spent in a state of disease? So staying alive is not the goal when it comes to how to think, but rather feeling alive. If the quality of our lives suggests a good understanding of these concepts, then you'll recognize that how you feel while you're alive is way more valuable than simply staying alive. If you have good quality of life, that's way more valuable than a poorer quality of life. Now, there's a comment made. Dennis Bolaños has indicated that Dr. Karazian said that without stress, and this is a comment from YouTube now, that without stress, we would be depressed. Do I agree with that? Let me use the analogy of a bone to answer that question. Did you know that bones remodel themselves based on how much stress is placed on them? So when you are in a low gravity environment, you will find that your bones will become weaker. They become brittle. They become less robust. And that's because the weight of our bodies and our atmosphere and the pressure around us and walking and jumping and all these things that we do day to day result in stress on our bones, and the stress causes our bones to remodel according to the lines of stress. It's called Wolff's Law. So in accordance to Wolff's Law, the more stress our bones are placed under up to a limit increases the strength of the bones. But it's not limited to just bones. This is how our bodies are in general. So a body without stress typically is a weaker body. A body without fighting illness or without fighting infection is a weaker body than a body that fights infection. So when you send your child to school and you realize that when they go to daycare, they get sick often. There are many parents who will try to pull their child from daycare because they don't want their child to be sick. But here's what they don't know. If you are exposing your children to infections early, especially infections that their bodies can overcome, then it primes their immune system to be able to withstand harder, more challenging things later on in life. For example, cancers. And this is something that many people did not know. Many people are totally unaware that cancer is an immune system disorder. Cancer is an immune system disorder. And the weaker your immune system is, the more likely you will develop cancer. The stronger your system is, the less likely that you will develop cancer. So hopefully that makes sense. So I am inclined to agree that without stress, we are weaker, which may predispose us to depression. But I wouldn't necessarily make the link to say without stress we will be depressed, because it's not a guarantee. No ill health outcome is ever a guarantee even when you present the person with the conditions that would make that more likely. The only thing that you can say is that it's probably more likely that they may be depressed, but it's not going to guarantee somebody being depressed. I hope that's clear. So watch now, the final slide again is feel better becomes get better. That's preferred. According to illness care way of thinking, get well is what we want to tell people, but the reality is that it's much better for persons to have the mindset of staying well. Make decisions that will maintain you in a state of good health. It's about the journey, not the destination. So it's the day-to-day choices that become the more important things. And finally, rather than simply saying you want to stay alive, how about feeling alive? Because if you can feel alive, you will have a much better shot at a good quality of life, free of disease, free of illness. All right, let's continue because we're doing well, but we need to get to the end here. Now, is pain a good thing or a bad thing? Is pain a good thing or a bad thing? Well, there are things about pain that's interesting. One of them is that pain has a purpose. But another thing is that pain is not totally reliable. So, whether it's good or bad, we know that it has a purpose, and the purpose, as written on the screen, is that pain alerts us that something has changed and needs our attention. But the problem with pain is that you can't trust it to always be there as your warning. Because sometimes you feel good and you think because you feel good, your health is good. But the reality is that good health is not equivalent to feeling good. Good health is not equivalent to feeling good. If you want to have good health, what you need to do is ensure that your body is functioning the way it's designed to function. Which means it's more valuable to check the systems of your body. Just kind of do an inventory to check the systems of your body and make sure it's working the way it's supposed to work. We need to trust our function and not just our feelings. Did you know, for example, and I like picking on cancer, it's an easy target. But did you know that many cancers do not have pain as a symptom until it's in its advanced stages? Because what people don't realize, cancer is not damage to cells, So because it's not damage to cells, you do not necessarily experience the inflammation, the pain associated with early stages of cancer. The damage to cells will come later. But in the early stages, cancer cells are regular cells that just fail to die. And so they keep proliferating and keep proliferating, and they, rather than dying and turning over and new cells replacing it, they continue going and going until it grows to a size where the blood supply that feeds the cancer is robbing your body of blood and nutrients, and so you find that you start to get sick. So when it comes to these things, it's important to appreciate that we have to start trusting how our bodies are working and not simply how it is feeling. So, how do we trust the feelings of our bodies? How do we trust the feelings of our bodies? there are different systems of our bodies. There are different systems of our bodies. And these systems are the systems that govern the function of all aspects of us. So when you look at it, you see you have the immune system, the endocrine system, the respiratory system, digestive system, musculoskeletal system. I'm going to try to see if I can remove my image here. My integumentary system, my respiratory system, reproductive, excretory, musculoskeletal, and nervous system. These are the systems of our bodies. And so if the systems of our bodies are in good working order, or if we are doing things that will promote the health of our bodies, then we are in much better shape. And so our focus needs to be on doing things that will support the health of each of these systems of our bodies. The best way to do this is with the choices that we make for food. So this is important. Alright, so hopefully that shows that. Now, the nervous system happens to be a very unique system in the body. The nervous system is the master control system of the body, and this system governs the behavior of all the other systems, so much so that once these systems are working adequately, we seldom ever get sick or break down or die. We seldom get sick or break down or die in the event of persons with good, healthy, working systems. Now, the nervous system is considered to be the master control system of our bodies. And what makes it considered such is because it controls and directs the function of all the other systems. Every other system has a connection to the nervous system, and that nervous system is in part responsible for governing the action of those systems. Now, how does this work? Well, it works because, or why does it work? It works because the nervous system is the system that houses the brain. And it is the brain that's responsible for the behaviors of every system in our body, including systems that we do not have voluntary control over. But we do have some control over it, and that is important. And that is important. Now, vertebral subluxations are misalignments in the spine that happen. We call it, the fancy name is vertebral subluxations, but all it is really is a misalignment in the spine. And the way that works is that if you have some traumas, for example, a fall or an accident, that can shift a bone out of place, because the nerves travel between those bones, you may interfere with the function of the nerves. And so this particular slide outlines that. You will see that the third bone from the top, the middle bone there, is not lined up with the other bones. And if you look at the back here where the nerve exits here, then because the bone has shifted, it has closed off the nerve space and starts to pinch on that nerve. Not only that, it will cause the disc to slip or bulge. And this is so important. So if we have misalignments in our spine, it can impact the function of our nerves and the function of the cartilage between the spine. And if this happens, then we are setting ourselves up for trouble. We are setting ourselves up for trouble. Because whatever that nerve now controls will not work the way it's supposed to work. And it might be that that nerve is responsible for digestion. Or it might be that nerve is responsible for the airways. And when you pinch off that nerve, the airway is going to spasm and causes wheezing. We call this asthma. And the question you may ask is, are you trying to say, Dr. Gardner, that a chiropractic adjustment to realign the spine can result in an improvement in somebody's asthma situation? And the way I would answer that is, I have treated many persons with asthma whose requirements for their inhalers went down significantly or drastically once they started chiropractic care. I'm not going to say that it cures it or it fixes it or what have you. I'll just leave it in that way. Now, there are three types of stresses in our bodies or that our bodies can experience. One is physical, one is biochemical, and the other one is psychological. These are the three stresses that our bodies are exposed to. Now, the healthier our nervous system is the better we're able to adapt to our environmental stresses. Now, the goal of good health is not to be free. The goal of good health is not to be free of stress. The goal of good health is to be able to adapt to any stress that we face. So we do not want to be free from stress. We want to be able to adapt to any stress that we are facing. That is the goal. And I hope that makes sense. Now we're winding down here. This slide, I'm going to try to see if I can go through it as quickly as possible. It's kind of a long slide, but it's an important slide nonetheless. So we're talking about our adaptive potential. Remember, our nervous system improves our ability to adapt to our environmental stresses. So that adaptation, we call it our general adaptive potential. That is the potential that we have to adapt to our stresses. And so we are using an analogy of a gap, GAP, to explain the gap, general adaptive potential. Let us go. Every gap has a lower limit and an upper limit, where the space between the two is the gap. The higher the upper limit is the more it approaches vitality. The lower the upper limit is the more it approaches death. Stresses in our environment or external stresses will push down on our upper limits, causing the gap to narrow. And the only thing that we have to counteract this is our internal resistance. That internal resistance pushes up against our external stressors and allows our bodies to be able to counteract the effects of the stress. So the goal really is not to minimize or eliminate our external stresses per se. A better goal is to maximize our internal resistance. But there are certain unnecessary stresses that we experience because some of us eat so poorly that we have a chemical stressor that is very difficult for our bodies to overcome. And so it messes up with our internal resistance. Any external stress that limits our internal resistance is not a stress worth having. Sleeping well, sleeping for good periods will improve our internal resistance. Lacking sleep is stressful and it reduces our resistance. Our experiences in life, we hope, will exist within the boundaries of our gap. And once those experiences just oscillate gently within the boundaries of our gap, we don't break down, we don't get sick. But if we continue to erode our upper limit and cause our upper limit to constantly fall, then what may end up happening is the upper limit may fall, and then what once we were able to overcome, now we no longer are able to overcome it, because now we become compromised in some way. As you can see, we get compromised in these two areas here. One might be diabetes. You may have a predisposition for diabetes in your family, so if you eat a particular way, you can rest assured that eventually when your resistance falls, you're going to develop diabetes. That's not what we want for you. All right? We want people to remain healthy by making wise choices to boost their internal resistance so that when the stressors come, we are able to resist it. The healthier our nervous system is the wider our gap will be. So our goal is to improve our nervous system function in whatever way is possible. One primary way that we improve our nervous system function is through chiropractic care. Chiropractic care helps to widen our gap because it improves our nervous system function. But chiropractic care in and of itself will not be adequate to overcome the stresses that we can experience day to day as people. In our office, we have specialized technology that allows us to be able to measure the effects of these stressors on our system. We call it the Insight Subluxation Station. It measures misalignments in the spine by way of checking the functions of the spine in terms of the temperature of the skin and the muscle tension along the spine. If those are working well, then your bodies are in a good resistance state. If they're not working well, your body is vulnerable and you may break down and get sick. In this slide, we are showing two people here, different brain scans that show the activity level of the brain. Now, the more active the brain is, the more areas of light that you would likely see. On this particular test, it's called a functional MRI. And the fewer lights is the less activity in the brain. Now, this lady was asked to wiggle her left ankle. The lady was asked to wiggle her left ankle. And her scan redone before and after an adjustment was made. And what we see is that before the adjustment, you had many areas of lights in the brain, and after the adjustment, you had fewer areas of lights within the brain. The areas of light will represent areas where the brain is doing more work. So the fact that after the adjustment you saw that there was a considerable reduction in the amount of lights that you saw, or the number of lights that you saw, suggests that this brain after the adjustment is working way more efficiently than the one before, because it requires less effort. And this is essentially what you will experience under chiropractic care. Your body just seems to work that much better. Now, let's move again. Many people ask, what kind of doctor is a chiropractor? It's important to note that chiropractors are not bone doctors. We are nervous system doctors. The work that we do may involve the bone, but we use the bone only as a tool to influence the nervous system. And so chiropractic is a tool of the nervous system. Now, chiropractors realign the spine, but chiropractic neurologists retrain the brain. So I have, as a function of being a chiropractic neurologist, specialized, I don't want to use the word training again, but specialized instruction that allows me to be able to retrain the brain by using brain-based exercises, balance therapy, eye movements, and so on, that we can influence different changes that we want to influence. These are conditions that we have treated at our office personally. And at Gardner Chiropractic, we have our vision is simple: to put people on a program of care. We have to identify subluxations whenever and wherever they happen, provide a program of care for each individual that's appropriate for their needs, and to educate the community. You will find that there are some times that I will put people on a program of 12 visits, which is like the majority time. But sometimes the visit frequency is less because they're not doing too badly. So this is important to note. All right? Providing persons with a program of care, as well as to educate our community. And guess what? What we're doing right now is one of those ways that we educate our community. So the last slide is this. The key to success in getting and staying well is for you to take responsibility for your health and well-being. Nobody else can do it for you. You have to do it for yourselves. We have some testimonials on our testimonial page, so feel free to stop by and check those out. So that is a 40% discount for anyone who, having watched us tonight, decides that they want to take advantage of this offer. So how do you take advantage of this offer? I'm going to write in the chat sections for both the email address .com. So I'm putting in the email address right now in the chat section. So if you turn to the chat, you will see it. So if it is that you would like to make an appointment to come see us, having watched this lecture, then you will get a special discount. That's if you're not a current patient. If you're an existing patient, that discount does not apply to you. And so what we would suggest that you do is watch the lecture and indicate on the same email that you are a patient, but you are not a new patient. And once a patient of ours indicates that they have watched the lecture, which we'll be able to verify by seeing your name written in the chat section, then what will happen is you will get one of the following, or depending, right? For every existing patient, you will get a 20% discount off your update exam, which is a considerable discount nonetheless. But not just that. For every person that you refer to the office, you will get a 20% discount off one treatment per person that you refer. And you will get a 10% off your next phase of care. This is very important. All right? So these are things that hold on, let me see. Oh no. Alright, sorry that you guys were not seeing the video. But you'll get 20%. Let's do this here. So, yes. Sorry about that. So you should be able to see it better now. All right. Sorry about that, guys. Hang on a second. Let me try to get back my Teams people. All right, so alrighty. So I lost my Teams people. All right, so hopefully they will see that. But write your name in the chat section in the email provided, and you'll be able to um, you'll be able to see the benefits. All right. Sorry for those who were on Teams with me. Teething pain, second class, just went a little bit long, but this is the last slide, and then we are finished. So hopefully they saw this slide. Just indicate in the comments appointments, and you should be able to see to get these discounts. But if you do not refer anyone, you do not get this 20% off. But once you've referred somebody, you get that one. But the other two, the 20% off your update exam, as well as the 10% discount off your next phase of care, will apply once you have indicated that you have watched this lecture. All right. It's been really interesting and fun, and it always is, getting a chance to interact with you guys. Hopefully, those who we lost on Teams would have joined us back here on YouTube. But yeah, it is good. I see that Donna is here again, so good to see that she came back over. But sorry I lost my train of thought there towards the end, just trying to solve this issue. Nonetheless, it was really good to be able to bring this lecture to you. There are a few things about us I want you to know. One is there is Back to Health Talk Show, which is a Facebook show that we have that we stream every Tuesday night at 8 p.m. Jamaica time, where you can hear me talk about health and health related topics. And it's from 8 to 9 Jamaica time. It's well worth watching. Um, you can catch us here at the same place every third Thursday of the month. We stream a new patient health workshop. It's basically the same lecture repeated, but we always mention different things from time to time. Um, but yeah, I would have loved to be able to answer questions via the people from the people on Teams, so I could hear their voices ask me the questions. But that's okay. The next time we'll do this, it shall be done better. But I appreciate those who were able to watch tonight. Keep tuning in. Thank you so much for all that you do. And yeah, take great care and be safe if you're not yet home. Take it easy on your way home. I'm about to leave to head home now. So take good care. Thank you so much for joining us. And I hope you had a rewarding experience. So, yeah.